Most people believe colon cancer is a disease of advanced age, something that happens later in life, something that can wait. But that assumption is becoming increasingly dangerous. In recent years, colorectal cancer rates have been rising in adults under 50. Many of these individuals had no idea they were at risk. The story involving James Van Der Beek has brought renewed attention to something we tend to ignore. The early signals are often subtle, and they are often dismissed. Colon cancer does not usually begin with dramatic pain. It begins quietly. Small growths called polyps develop along the inner lining of the colon. These polyps can exist for years without causing severe symptoms. During that time, they slowly accumulate genetic mutations. Some remain harmless, others progress into malignancy. The key is that this transformation takes time, which means there is a window for detection and prevention. The problem is not that the body stays silent. The problem is that we ignore what it says. One of the earliest signs is a persistent change in bowel habits. This does not mean one unusual day. It means a new pattern that lasts weeks. Chronic constipation when you were previously regular. Frequent loose stools without infection. A sensation of urgency that feels unfamiliar. These changes signal that something may be altering the structure or motility of the colon. Another critical warning sign is rectal bleeding or blood in the stool. It may appear bright red. It may be dark and tar-like. Sometimes it is so subtle that only laboratory testing detects it. Many people immediately attribute bleeding to hemorrhoids. And while hemorrhoids are common, assuming the cause without proper evaluation can delay life-saving diagnosis. Unexplained fatigue is another powerful clue. Colon cancer can cause slow, chronic blood loss that leads to iron deficiency anemia. You may feel drained, mentally foggy, less productive, or short of breath with minor exertion. When routine blood work reveals anemia without a clear explanation, the gastrointestinal tract must be examined. Persistent abdominal discomfort should never be normalized. Cramping, bloating, a feeling of incomplete evacuation, or pressure in the lower abdomen that does not resolve may indicate a growing lesion interfering with normal bowel movement. The colon is not designed to cause ongoing pain without reason. Weight loss without trying is also a red flag. If appetite decreases, digestion feels different, and weight drops without lifestyle changes, that is not a coincidence. Cancer cells consume energy. They alter metabolism. They change how the body distributes nutrients. Perhaps the most important concept to understand is this: early-stage colon cancer is highly treatable. When detected before spreading beyond the colon wall, survival rates exceed 90%. Once it metastasizes to distant organs, those numbers fall dramatically. The difference between early and late detection is often timing and awareness. Screening is not just diagnostic, it is preventive. A colonoscopy allows physicians to identify and remove precancerous polyps before they transform into cancer. That is one of the few situations in medicine where we can literally stop cancer before it starts. That is why guidelines now recommend beginning routine screening at age 45, and earlier if there is family history or genetic risk. But statistics alone do not explain why cases are increasing in younger adults. Researchers are examining several contributing factors. Modern diets, low in fiber and high in processed foods, alter the gut microbiome. Sedentary lifestyles slow intestinal transit time. Chronic low-grade inflammation may accelerate cellular mutations. Obesity and insulin resistance further amplify risk. The gut environment is not passive. It is dynamic. The trillions of bacteria living in the colon influence immune function, inflammation, and even gene expression. Disruptions in this ecosystem may create conditions where abnormal cells are more likely to survive and proliferate. There is also a social component. Digestive symptoms are uncomfortable to discuss. Many people delay seeking help because they feel embarrassed or assume they are overreacting. Unfortunately, hesitation can cost time. And in oncology, time matters. Family history changes the equation significantly. If a parent or sibling has had colorectal cancer or advanced polyps, screening should begin earlier. Certain hereditary syndromes increase risk dramatically, making proactive monitoring essential. Prevention strategies extend beyond screening. A diet rich in vegetables, legumes, and whole foods increases fiber intake, which supports healthy bowel movements and beneficial bacterial populations. Regular exercise improves circulation and reduces inflammatory markers. Maintaining a healthy weight decreases metabolic stress on tissues. Limiting alcohol and avoiding smoking also reduce risk. Both substances contribute to DNA damage and chronic inflammation. Small daily habits accumulate over decades and influence long-term outcomes, more than we often realize. What James Van Der Beek's story reminds us is not fear, but vigilance. Health does not depend solely on how we feel today. It depends on how early we respond when something changes. The body rarely whispers without reason. Persistent changes deserve evaluation. Blood in the stool deserves testing. Unexplained fatigue deserves investigation. The goal is not anxiety. The goal is awareness. Colon cancer is increasingly affecting people who believe they were outside the risk window. The screening age has shifted because the data has shifted. That means our mindset must shift as well. If something feels different and it remains different, listen. Acting early is not overreacting. It is intelligent prevention rooted in evidence.